leading media platform and healthcare magazine in the MENA region is at Fakeeh University Hospital. We are in conversation with Dr. Mohaymen Abdelghany about the digitization of healthcare.
Well, first of all, thank you very much for having me today with you in this interview. My name is Mohaymen Abdelghany, and I'm a physician by background. I've been in Dubai and the UAE for the past almost 20 years. I had the privilege to run several hospitals and health systems in the region, and I've been with Fakeeh for the last 6 months. A very interesting journey in such a short time for me, and I love to say that it was a privilege to work with this distinguished team here and to work in this facility. Fakeeh is part of a larger group in Saudi Arabia, which is more than 4 decades. The flagship has been there for 47 years in Jeddah, the flagship hospital, and it's one of the largest healthcare providers in the Kingdom of Saudi Arabia, with so many achievements as the first in the region. They distinguish themselves by being an integrated healthcare delivery model. And we are doing the same here in the UAE. Since we started in late 2020, we are an academic healthcare model, an integrated care model, where we provide healthcare services, we provide education, we provide research, and enable that with the technology platform. This is the main differentiator in the model. It's an integrated care model. Dubai Silicon Oasis, there is nowhere else where this hospital could be located than the Dubai Silicon Oasis, which is the future innovation.
So what are your personal thoughts when we talk about digitization of the healthcare?
One of the constants in healthcare, and I think in many other industries, is change. The move towards digitization have been almost for decades now. But there are moments where we realize that, yes, we have to adopt more and more digitization. And I think COVID was a turning point. When COVID came, we had issues with patients accessing the care. These movement restrictions and people move towards hospitals was not as it is in normal days. So there had to be some alternative ways. And this alternative way, like the telemedicine or the telehealth, it was existing for decades before COVID. But when COVID came, it has accelerated that to a great extent. During COVID, everyone was happy to access the care. Everyone was happy to receive the clinical and medical advice timely, promptly. Everyone was happy to experience the medication delivery mechanisms, which was not very widely accepted earlier. So all this together brought a different type of practice, which sustained even after COVID to some extent. And it has taken the digital movement from one level to the next level. And I think also AI itself has played a role in the vaccines and the acceleration of the discovery of the vaccines, so that we have cut down huge amount of time during the time of the peak of the pandemic where we needed this time. So I think this moment has been a very important turning point.
And how has the digitization improved the patient experience?
From patients, actually patients can benefit a great deal from that. So in a world where we can connect all the data, all the information, all the medical information of the patient, patients can have access to their information very timely. They have the choice to take this information to which provider because it's available. Patients can have access to their reports, their medical reports, their investigation reports, their lab and radiology reports at their fingertips. Patients can have access to schedule the appointments, cancel the appointments, decide the best time to see the doctor at their fingertips. All this cannot happen in a normal way. It has to happen with these digital enablers. Now, if we want to advance this further, we can say the decision-making process of patients. Patients get more informed now through accessing more information about their health from the provider and from the digital tools that provide this information as well. So all this plays a major role in enhancing and advancing patient experience. And I think in Fakeeh, this is what we adopt. We get the patients involved in the care. This is very key. They know what they are going through. They are part of the decision making. They get informed, and we get them connected to us. They are connected digitally, as well as they are connected on person basis with the care provider. We look at the different areas. When it comes to patients, we look at the patient experience scores. We always monitor the patient experience score. How likely would the patient recommend the hospital to others? Their family, their friends, their relatives. When we look at our rates, we get above 90% in outpatient and inpatient, both almost 89, 90%. So we're glad that 9 of 10 patients who come to Fakeeh University Hospital recommend it to others. This is very key for us, and these digital interventions are our tools to make this experience happen. So this is one thing. For example, on the clinical outcomes, we look at the speed of diagnosis. For example, we use some artificial intelligence tools to help us in the diagnostic imaging with the chest X-ray and the chest CTs to get to rapid, accurate diagnosis faster than the normal process. So they can screen those who have some normal reports, and the physician doesn't take much time in them. And the physician focuses on those who might have a possibility of some abnormal results. So they can focus more and give more precise diagnosis in a less time. And we also look at organization-wide. So for example, if we are to look at how efficient are we in using energy, we measure through our smart building management system, and that goes in line with the sustainability efforts, our carbon footprint, our waste and our water consumption. All these issues, they are monitored through the technology, and we can know where we are now and how we are improving in that front. How the organizations talk to each other. The patient is here today and tomorrow he's in another hospital or he's going to another provider within Dubai or outside.
Yeah.
And the vision of the leadership in Dubai and what Dubai Health Authority and other health authorities in the UAE have been doing, they have implemented health information exchanges where, as a clinician in Fakeeh Hospital, if the patient comes to me from another hospital, I can have access to this information, which is very key in reducing the time. I don't need to do repeat exams or repeat tests. So it reduces the burden on me as a clinician whenever I handle the patient. And also it gives me vital information about the patient's medical and past history and past clinical notes that it can guide me in the care process. So that's on one side, something that has been done beautifully. NABID is the Health Information Exchange of Dubai, working very well across all healthcare providers. Yeah. Any patient in Dubai who comes to another healthcare organization, we have access to the information.
Okay, that's really interesting that we were not aware that this is being implemented. I think we were talking about it, this particular facility being implemented a year ago.
Yeah, now this is fully implemented. Okay. Abu Dhabi have Malafi, and Riayati is now in Northern Emirates. And the next project is to connect these 3 health information exchange to any patient in any part of the UAE. I think something very near will come, which started already. It's about how precise is the care. I mean, do I provide the care as an average to everyone, or I provide the care to that individual based on the genome actually? So you know that the UAE started the genome project, and luckily more than 100,000 were there in that genome project. And I think the more that expands and the more data we collect from the electronic medical records, we will be able to customize, individualize, and come up with very precise medical plans or healthcare plans for each individual. And that can come to the level of individual dosing of medications rather than an average dose. That can come to individual intervention at and when needed. That can come to prediction of the future health status of a person, which we call it precision medicine. This is actually in the pipeline. But the base for that is the current healthcare data, which is huge, but it was not much utilized. Now with linking these to the genomic and the EMR data, we can have data lakes which can guide us. And of course, the implementation of AI tools on top of that will help expediting this process. We are geographically expanding, opening a new day surgery facility on Sheikh Zayed Road, which will expand our catchment within Dubai. We are also expanding into a smart clinics program, which will provide care at different commercial or recreational or residential sites through smart clinics connected to the hospital.
When you say smart clinics, can you elaborate a bit more on that?
Exactly. This is part of the digital transformation we're trying to lead in the region. So we will be having community access to our service through the connected health. So anyone can have specialist care remotely. So they can go to visit this smart clinic, which will be staffed by a nurse and a general practitioner. But in this clinic, they have access to the specialist service. Okay. So let's say the patient won't see a cardiologist. The stethoscope in this, the doctor can hear the heart beats in the hospital. Or the ultrasound machine there, the doctor can see the ultrasound in the hospital. So instead of keeping the patient moving, we are moving to the patients.
Thank you, Dr. Mohaymen, for joining us today. It was really a pleasure interacting with you and talking to you about digitization of health.